Yes.
And I agree. I don't know where the below expectation places it, between 0 and 9, but it is true. There is a public outcry on how the SHA is working. There are areas we hear of exemplary coverage in terms of bills and ensuring the service provision was efficient and effective. And there are also other quarters largely where you hear complaints. Unfortunately, this is a conversation that revolves around a system that ought to be safeguarding life. You know, it's not about clothing or even, not that it's a better comparative, but it's not about even education. It's about people who are ailing, who are sick, who are just minutes away or a level of care away from losing their life or their condition exacerbating. So these complaints cannot just be statistics and numbers. It is okay, yes, we'll do a survey as an association to try and identify the gaps and see how they can be filled. But when you look across board, the standard practice of universal health coverage, should it be laden with so many gaps 2 years later?
Absolutely not. And I can tell you a few problems that we are facing.
Right.
First of all, like you say, 2 years is a long period of time to keep on having the same conversation all through. We do service, like I've mentioned.
Right.
And when we do this service, they don't end with us. We share it with them. And we tell them from the provider side of view, this is how we are seeing it. If you can look at this, you can look at this, amend here, change here, see how you can improve here, then the system will run well. Apparently, we do not have a SHA leadership or the MOH leadership that listens. It is either their way or the highway. We have made this point very clear that for you to have a system that is working for all, you need to have these three parties on the table. That is the payer, SHA.
Right.
That is a provider,
the hospital,
the healthcare facilities,
yes.
And the patient. When you have these three people on the table, you can't miss on a solution, because universal healthcare surrounds around these three parties. And it so happened that the leadership of MOH doesn't listen. And many times when there is a public outcry, they run to the patient and they say, we had a conversation with them, and this is what they are saying. They have left the other party out. And this being, to make it a complete circle that works, all these three parties ought to be on the table and speaking the same thing, agreeing on the same direction. It is in the Bible, two cannot walk together unless they agree. Yeah. So if one party is left behind,
right,
then you will not